Electroretinography, ERG, with interpretation and report, full field, i.e., FFERG, flash ERG, Gansfeld ERG. Multifocal, MFERG. A normal retina has a predictable electrical response to light. To determine if the retina is damaged, the physician places an ocular-fitted contact lens electrode on the patient's eye and another electrode on the forehead so that the retina's electrical responses to external stimuli can be recorded under light-adapted conditions. Electroretinography, often abbreviated ERG, is repeated in dark-adapted conditions. The ERG waves are analyzed by the physician. Various techniques may be used based on which area is being targeted. Report 92273 for a full-field ERG, flash and flicker. A multifocal ERG targets photoreceptors in a number of separate locations, including the macular, looking for concentrated areas of abnormality and may take more time to complete than a routine ERG. Color vision examination, extended, e.g., anomaloscope or equivalent. This test describes an extended color vision examination involving an anomaloscope or equivalent, which is an instrument used to diagnose abnormalities of color perception in which one half of a field of color is matched by mixing two other colors. Dark adaptation examination with interpretation and report. This exam tests the function of the two photoreceptors, the rods and the cones. Rods are most sensitive in dim illumination and are responsible for night vision. The cones are more sensitive in bright luminations and are responsible for day vision. The eye to be tested is exposed to a bright light and the room is darkened. At 30-second intervals, the light is increased and the effect of the stimulus on the retina is measured by a adaptometer machine. External ocular photography with interpretation and report for documentation of medical progress, e.g., close-up photography, slit lamp photography, goniophotography, stereophotography. These photos are often referred to as anterior segment photography and are used to document abnormalities of the anterior segment that do not require magnification to be seen in the lids, cornea, anterior chamber, lens, and iris. The physician photographs the eye using a freestanding camera, a camera affixed to a slit lamp, goniophotography, or stereophotography. Anterior segment imaging with interpretation and report, with specular microscopy and endothelial cell analysis. The provider performs microscopy, often called endothelial cell analysis or specular microscopy, to check the integrity and density of the endothelial cells that comprise the innermost layer of the cornea. Anterior segment imaging with interpretation and report, with fluorescein angiography. The angioscopy begins when a small amount of fluorescein dye is injected into the arm. The dye is transported to the eye through the blood vessels. As the dye traverses the vessels in the iris is viewed through the scope using filters that enhance the fluorescence of the eye. This test is most often used to delineate fine neovascularization of tumors in the anterior segment. Replacement of contact lens. The ophthalmologist meets with the patient to discuss replacement of contact lenses, which may be due to wear and tear of the existing pair, loss, or discomfort. A new prescription is a separately reported service. Fitting of spectacles, except for aphakia, monofocal, bifocal, multifocal, other than bifocal. The physician or technician measures the patient's anatomical facial characteristics, records the laboratory specifications, and performs the final adjustment of the monofocal, bifocal, or multifocal spectacles to the visual axis and anatomical topography. Fitting of spectacle prosthesis for aphakia, Monofocal. Multifocal. The physician or technician measures the aphakic patient's anatomical facial characteristics, records the laboratory specifications, and performs the final adjustment of the monofocal or multifocal spectacles to the visual axis and anatomical topography. Fitting of spectacle-mounted low-vision aid, single-element system. Some low-vision aids are simply a convex lens mounted to spectacles. The physician or technician measures the patient's anatomical facial characteristics, records the laboratory specifications, and performs the final adjustment of the monofocal spectacles to the visual axis and anatomical topography. Fitting of spectacle-mounted low-vision aid, telescopic or other compound lens system. A focusable Galilean or Keplerian, internal prism, system in a spectacle frame is a popular choice. The fitting of the spectacles is separate from the prescription of the spectacles, which is considered part of the eye exam. The physician measures the anatomical facial characteristics, writes laboratory specifications, and makes the final adjustment of the spectacles to the visual axis and anatomical topography. Prosthesis service for aphakia, temporary, disposable or loan, including materials. The physician or technician procures or provides a temporary, ready-made contact lens to a patient, whose natural intraocular lens had been previously removed surgically. Repair and refitting spectacles, except for aphakia. Spectacle prosthesis for aphakia. The physician or technician repairs or refits a pair of spectacles. Adjustments may be made to the ear or nose pieces, or plastic frames may be heated and bent to better fit the patient, who has natural or artificial intraocular lenses.